I was married. I lost my husband. After his death, I had an HIV screening and I was positive. I have been seropositive now for 14 years.
Je suis tombée malade en 2006.
I got sick in 2006.
On m'a fait le test.
I took the test and it was positive. I have now accepted the condition and I live with it.
Je vis avec sans problème.
When I was down, except I was just confused and I was just down. And after when I have joined the mutual health, after the education that the hospital has given me to join the mutual health, the mutual has supported me a lot. The mutual has supported me on my bills, on my during my tests, my CD4 counts, my hospital bills, my treatment, and the rest. I'm very grateful with the mutual health. I think my life now has changed from what had been at first because of this help that the mutual health is doing with me.
Initiated in 2003, mutual health organizations, MHOs, have become the cornerstone of the German Development Corporation and the government of Cameroon's micro-insurance and health mutualism plan. The scheme seeks to open at least one MHO in every health district and to help give at least 40% of Cameroonians health care by 2015. The main goal has been to improve access to health financing support and quality health care. The GTZ concept of developing community-based health financing schemes quickly gained fame in some of the poorest parts of the country, enjoying the legitimacy of being a grassroots-driven movement with a wide outreach stretching out to the most vulnerable.
The mutual health service, first of all, is a community health insurance that takes care of the sick. So in the home community mutual health insurance, before you be a member, you have to register 1,000 francs registration and at least 14,000 francs contribution from 1 to 4 persons. After this exercise is being carried out, you have to undergo an observation period of 1 month, after which the registered persons start benefiting from the services. In the mutual health insurance, you benefit consultation, you benefit hospitalization, you benefit operation, and you benefit delivery.
Despite having some 60,000 registered members and providing health care to 33% of the country's health districts, MHOs from its outset did not include one of the fastest growing disease, HIV and AIDS. Including HIV coverage would have been too costly and might have weakened the existing chain of solidarity considerably, even probably leading to the failure of the health mutualism plan.
When we got to WOM to set up the WOM Mutual Health Organization, I was particularly touched when a man pulled me aside and said, "I am a person living with HIV. You just said in the hall that the MHO does not cover persons living with HIV. It is not because I am living with HIV that I am condemned to die."
Under pressure from persons living with HIV, the GTZ in 2007 conceived and proposed a project to the German government. A project designed to embrace HIV into the list of diseases covered by the Mutual Health Organization. The approval of this project coincided with the decision of the government of Cameroon to make ARVs, antiretrovirals, totally free.
Initially, the cost of treatment was 400,000 francs. It was later reduced to 70,000 francs, and today it is offered free to the entire population. The Ministry of Public Health has placed agents at various communities in all regions of Cameroon and in all health districts. Persons living with HIV now receive medical follow-up and treatment at home, all this free of charge.
Nous avons vu dans le passé que malgré le fait que les antirétroviraux
In the past, despite the fact that antiretrovirals were available free of charge, frequently persons living with HIV could not afford the complementary cost. A year and a half ago, we started seeking ways to try and relieve persons living with HIV in order that treatment be effective and properly administered. We therefore introduced the idea of mutual health organization for health coverage so that coverage is assured and mismanagement avoided.
In June 2007, a pilot phase of the project is started in 5 MHOs. Its target? To give healthcare to some 1,500 persons living with HIV in the space of 6 months. At the end of this pilot project, the objectives, initially spelled out, are attained. Barely 3 months after some 919 Health Mutual members living with HIV are treated of opportunistic diseases and get coverage for follow-up and laboratory tests estimated to cost between 25 and 310,000 CFA francs. By 2008, 21 mutual health organizations exist in Cameroon. By August 2008, at least 3,121 persons living with the disease had received health care and counseling. Some 498 members of mutual health organizations had benefited from the treatment. In fact, 20% of persons enjoyed health coverage in 2008. Comparatively, on the whole, a net improvement in the condition of persons living with HIV/AIDS and getting regular follow-up under the GTZ scheme was observed that same year.
Grâce à un programme spécial de la GTZ,
thanks to a special program by the GTZ, our MHO gives 100% coverage to persons living with HIV. Opportunistic diseases are taken care of by the GTZ.
This is a big help that most of our clients are really appreciating, because we see a good number of them actually coming here with a lot of ease and getting their drugs, so long as they know that the GTZ has put in place a program like this.
Kumbo, in the northwest region, is one of the towns where the mutual health organization, initiated by the GTZ, has developed remarkably, especially with the support of local administrators. A few other examples include Wum in the same region, Fumban in the west, and Manjo in the littoral.
The Kumbo Mutual Health Organization is the child of the Kumbo Urban Council, because it featured in our 2002-2007 strategic plan. And when we sold this plan in Yaoundé, GTZ Santé bought the idea of coming to Kumbo to work with the council to institute the Mutual Health Organization. And first of all, the role of the council was to facilitate and ensure that the Mutual Health Organization takes off. People who are sick of HIV/AIDS and other patients to benefit from quality health services through the MHO.
We have close to 14,000 beneficiaries. And in addition to that, we have about 500 beneficiaries of people who are living with HIV/AIDS.
Women are most vulnerable. Housewives, single women, divorced women make for the highest prevalence rate. We have a prevalence rate of 18% that we have strongly condemned. This is how we decided to knock on the door of the GTZ after we learned of this MHO program.
The health mutual system set up by the GTZ has unquestionably become a vital part of the effort of the government of Cameroon to improve access to money and to health care in the country. This program is part of a bigger scheme of existing efforts that include national technical services. These functional structures are working to organize local communities into a solidarity chain against diseases. The Special Fund for Health plays a key role in sustaining this effort.
The Southwest Provincial Special Fund for Health is an institution responsible for the improvement of the overall health care of the people of the Southwest Province. That's its main vision. It has as its main objective also to ensure the continuous availability of essential medicines in all public health facilities.
We supply more than 150 public health units with drugs, and you need to go to the furthest place like Bauru, like Furawa.
Not only drugs are given out, but all that goes along with it, namely training, control and support to the healthcare system of the province.
Every dawn, truckloads of essential drugs like these leave special funds for health existing in some regions of the country to distribute medicine to some of the farthest and inaccessible health districts. We are at the Special Fund for Health of Buea, and this team of medical personnel is working to dispatch essential drugs to some 18 health districts in the southwest region of Cameroon. The distribution of essential drugs by the Special Fund contributes to strengthen the partnership between the mutual health organization and health centers that provide health care. This also adds to the credibility of the MHO at the grassroots, as communities actually share the cost of healthcare, making it more accessible. The MHO thrive on health insurance, arising from principles of solidarity and mutual assistance through individual member and household contributions donated freely. The Special Fund upholds the entire system. One of its major responsibilities is to make reinsurance possible to sustain the scheme. So far, this has been made possible across GTZ funding.
The Special Fund for us is a reinsurance fund as regards the follow-up of persons living with HIV. The Special Fund is today our link with the GTZ, our sponsor.
We are directly under the supervision of the Special Fund for Health. The Northwest Special Fund is responsible for the payment of bills of people living with HIV/AIDS. So at the end of every month, when we receive the bills from the different health institutions, we compile them and send them to the Special Fund for subsequent payment.
Medical advisors guarantee a certain level of transparency each time they cross-check hospital bills of Health Mutual members received from health centers.
Nous avons mis en place ce qu'on appelle les médecins conseils.
We put in place medical advisors who in fact study all prescriptions and the services of health centers. So they tell us if a case is in reality an HIV carrier or not. This brings in more seriousness and cuts the expenditure of the MHO as they cross-check these bills. For example, some bills have dropped from 1 million to 150,000 francs CFA thanks to their control. There are two types of documents in the medical file. The administrative documents kept by the MHO, like bills and hospital booklets from the health centers, and a list of beneficiaries. The clinical document includes treatments, x-rays, laboratory, consultation, and emergency unit files. This gives the medical advisor a complete appreciation of the services given to the patients.
Ces factures sont payées à l'avance.
These bills are paid up front by the MHO. So you can see that the GTZ actually pays 100% the charges of persons living with HIV within the MHO.
Nous remboursons le montant à la mutuelle de santé.
Sa, about 90 kilometers outside Yaoundé, the capital of Cameroon. Albertine and Louise spend whole days walking the streets of this small locality, doing door-to-door sensitization. Over 300 kilometers away in Fumban, Fadimatu and Irene scout the corridors of the Fumban District Hospital, chief town of the Noun Division in the West region of Cameroon. In fact, they are all persons living with HIV and AIDS and members of MHOs. They are known here as expert patients.
Un patient expert est détecté lors de la formation.
The expert patient is spotted during observance training. Because the most important training is that given to the communities of persons living with HIV. The introduction of this training makes it possible for patients and doctors to come together and discuss the difficulties and the best ways of getting about the therapy. This helps medical staff to know how the treatment is taken and to figure out how and where to improve the health care. For the patients, it is also very important for their follow-up because they can better take their treatment and they can assist others to better follow their therapy and avoid drug resistance. We select all those who had the best scores in the pre-test and post-test on all the courses taught during training. These are the persons who are not only willing to make public testimonies on their status and conditions, but are the most intelligent and have time to consecrate to other patients in hospital.
Expert patients have become the link between HIV's specialized treatment units in hospitals and mutual health organizations. Dealing with HIV is a complex issue, and these expert patients, however, enjoy the authenticity of having first-hand experience of HIV.
I have 2 days in the hospital where I have to follow up patients, the old one and the new ones, and I have to see into their problems.
My work is to follow up clients who are on ARV, to see how they are taking on their drug and to educate them more on how to take ARV in time, nutrition and health.
When we do sensitization, patients prefer us to hospital staff because we are like them.
The success of expert patients in the GTZ scheme can be measured at many levels. The percentage of infected persons who respect their daily therapies had risen from 38% at the start of the project to 42% by April 2008 and 81% in August of the same year. The percentage of persons who now systematically use condoms in sexual intercourse has risen from 13% at the onset to 23% in April 2008 to 36% in August. Expert patients now spend whole days in hospitals which have specialized treatment units for HIV, encouraging persons to know their HIV status, respect their prescriptions, and join MHOs.
We are grateful to GTZ for coming through Mutual Health to help our patients register for assistance. And if not of this organization, we really had been facing a lot of difficulties in the past. So we don't more have HIV patients crowded in the hospital because of lack of bill.
The number of patients we have on treatment now is from 1,500 to 1,900 between that. Then the number that are not yet taking drugs are about 3,000. We are found in a remote area where people are really poor. Mutual Health has come to help us in paying the bills for those who are not able to pay. They really pay the bills for the chemistry that we do, the CD4, and sometimes some drugs.
Doctors are more comfortable when prescribing tests and treatments to patients who belong to MHOs. They are certain these patients can foot the bill. Patients who belong to MHOs also get some reductions at the level of the pharmacy.
Like hospital staff, in most specialized treatment units for HIV and managers of MHOs, expert patients too have the responsibility of preserving the secrecy of all infected persons unable to face social stigma. Nowadays, privacy has become a very important part of any health care and follow-up plan involving HIV. As an expert patient herself, Albertine explains her direct experience with the damaging consequence of non-respect of confidentiality.
When I got sick, I was still in the hospital bed, but everyone knew of my status. When I came out, People pointed at me, and I wondered why. The laboratory technician had the guts to disclose my HIV status, telling people to forget about my beauty. I dragged him to court.
It is in a bid to avoid a repeat of similar incidents that the GTZ's training plan gives great value to the management of confidentiality and anonymity.
Training on confidentiality management involves just everybody, from nurses to laboratory technicians and doctors. Everybody directly involved with healthcare and follow-up is concerned. The new model we set up is more subtle. This involves, first of all, ensuring medical files do not carry names. Only one person has access to database on the membership list of MHO, which is the manager of the MHO.
When you look at our documents, we have code numbers, special numbers that we give to people living with HIV/AIDS. When they are treated at the level of the hospital, we don't get their names. We only get the code numbers, the various code numbers at the level of the office.
The doctor knows who is an HIV carrier since he has the right to know. But in the MHO, it is impossible to tell who has been treated for what, so everything remains anonymous.
To ensure the management of confidentiality, the GTZ has equipped existing mutual health organizations with computers and other tools necessary to guarantee utmost discretion. This is the case with the Mutual Health Organization of Fumban, which receives its computer. For the GTZ, the ideal scenario is enabling persons living with HIV to be able to foot their own bills across mutual health organizations and other income-generating activities. The success of the MHO in Cameroon has encouraged other countries in the sub-region, also seriously affected by HIV, to follow in Cameroon's steps.
L'esprit de mutuelle de santé s'est beaucoup plus avancé au Cameroun.
The idea of MHOs is much more developed in Cameroon, and other countries are equally interested. We count on the collaboration of the GTZ to see how in 4 years, in the second phase.
For now, HIV remains a concern to international cooperation and to the Public Health Ministry.
A person living with HIV is like anyone else. We think in order to avoid the marginalization of these persons, those living with HIV should belong to a mutual health organization. The best way to promote these activities is to better organize access to healthcare at the level of MHO and insurance, and give patients more autonomy and less dependency.
The health policy put in place by the government of Cameroon gives people the possibility of getting health care from a wide range of hospitals, religious or state-owned.
The goal of the health sector strategy, to cover at least 40% of the population in 2010, has been pushed forward to 2015. We hope to achieve this within this time frame. We also hope there will be a progressive integration of social security in its entirety, for the old, for children, for needy, indigents, and persons living with HIV.
For all the stakeholders involved in the project, the challenge is to sustain it.
Il y a des structures au Cameroun, comme par exemple le mutuel.
There are existing structures in Cameroon, like the MHO, which have attained a level of autonomy, capable of freeing them from foreign support in some years to come. The other concern is the need for financing. I must confess that after the HIPC initiative, Cameroon should not continue to be counted among the poorest states. Funds exist. Funds ought to be made available. I now think it is left for the government to use these funds correctly. I believe the fight against HIV figures amongst the priorities in the fight against poverty.
C'est dans l'intérêt du gouvernement camerounais à utiliser ces fonds pour les fins pour lesquelles ils ont été attribués.
Fighting against poverty also entails ensuring Cameroonians enjoy the right to proper health care. This includes the effective treatment and follow-up of persons living with HIV and AIDS. Beyond making antiretrovirals free, the government of Cameroon has realized that the MHO is a sure path to basic health care for persons with HIV and for all Cameroonians.